In an effort to continue to support communities across the greater Chicagoland area and beyond, Compass Health Center is proud to sponsor the American Foundation for Suicide Prevention's Out of the Darkness Chicagoland Experience event and support their goal to reduce the national suicide rate 20% by 2025. In fact, Compass staff recently chose to donate more than $3,000 towards this goal. Although this year's walk will be completely different than years past, the message remains the same. We must continue to take action to help prevent suicides. The overall suicide rate in the United States has increased by 31% since 2001 and affects people of all ages, genders, religions, and ethnicities. Suicide does not discriminate, but it's important to understand that it can be preventable. Compass is a mental health organization in the Chicagoland area providing partial hospitalization and intensive outpatient programs for children, adolescents, young adults, and adults. We currently have locations in the northern suburbs, the city, and virtually, with our next location slated for the summer of 2021 in the western suburbs. Compass was founded in 2011 and has continuously grown in an effort to keep up with the needs of the community. Our programs provide evidence-based treatment for individuals whose mood, anxiety, trauma, and OCD symptoms significantly impair their daily functioning. A great majority of our patients are experiencing suicidal thoughts, and many have made suicide attempts. Our comprehensive treatment includes group, family, and individual therapies, as well as psychiatric management, all of which are oftentimes life-saving. We are grateful to be able to support individuals both on-site and virtually. The next two sessions will be co-led by some of our remarkable Compass staff. The Blue Bead session, supporting suicide prevention at 10 a.m. will be led by Dr. Natalie Gella, the director of our Northbrook Trauma Program. And the Teal Bead session, supporting someone who struggles or has attempted at 11 a.m. will include Tracy Pape, primary clinical therapist of our Northbrook Trauma Program, and Heather Katz, trauma family therapist in Northbrook. Thank you so much for being here. We hope that next year we will be able to walk in person as we continue to fight suicide together.
Good morning, everyone. Thank you, Dr. Welke, for your thoughts and your inspiration. Good morning, and thank you for being here. Thank you for joining us today for the Out of the Darkness Chicagoland Experience and the Blue Bead Community Discussion presented by Compass Health Center. My name is Dr. Natalie Gella. I'm a clinical psychologist and the director of the trauma program at Compass Health Center in Northbrook, Illinois. I work with many people who struggle with thoughts about suicide, and I am very happy to be part of this incredible event. We are so grateful that you are taking the time and joining us to hear stories, build community, and create connection today. This discussion will be about supporting suicide prevention. We will provide a general overview of suicide prevention and how we can work with each other towards this goal. First, I want to introduce some special guests, Beth Morrison and Bob Strada. Thank you both so much for being here today. Beth, if you wouldn't mind, please introduce yourself and go ahead and tell us a little bit more about why you support suicide prevention. Beth, I'm going to pause you real quickly. It looks like we're having trouble hearing your audio coming through. If it's okay, Beth, while you are taking some time to figure that out, Bob, would you mind going ahead and introducing yourself and telling us a bit about why you're here and why you support suicide prevention?
Sure. Hi, my name is Bob Strada, and for the past 7 years, I run a team called Team Bond. Fortunately, in my life, I have not had the issues of that, but I've had some friends who have had it, and I just see the terrible part of their life when they are going through crisis. It's something that needs to be addressed and spoken more to, and hopefully that we can help those people that are in need to try to get through this before times get worse on them. Just bringing up my own childhood when I was a boy, I, it's hard to comprehend the darkness people must be going through when they are in crisis. Because as a boy, I was happy-go-lucky, waiting to get outside, go play ball, and just for the lights on the street to go off and come on back home for dinner. And I'd never had those kind of issues, or in my family, I was lucky enough to avoid any of that. Most of my family and friends have that. I do have a few friends who do suffer from the situation of getting into dark spots at time, and I try to convince them to seek the help that would help them eventually, and track them out of their situation of crisis. So therefore, for the last 7 years, I've asked my friends and family to help support this fabulous cause and try to help the people that are in need of that.
I'm going to try that again. Technology is beautiful. Thanks so much, Bob, and thanks again for being here. Beth, let's try it again. And again, this is Beth Morrison, and let's see if we can hear you. No. Well, perhaps, and I know, Beth, you are working hard on your end. Perhaps we will go ahead and move forward. And if we're able to, maybe bringing you back in at the end to say a few words. And again, thank you both just for being here. And this is one of those things that we put up with technology. Sometimes it's not perfect. No, still
Thank you
no.
for the opportunity.
Well, thank you both. So what we'll go ahead and do now is share some slides about suicide and the importance of working together to prevent this leading cause of death. Some of you may be familiar with this information. For others, it may be a good refresher, and for others, it may be completely new. So let's go ahead and get into it. So I want to start by talking about how suicide is a serious public health issue. Every loss is a tragedy that affects family, loved ones, communities. There are important steps that we can take as individuals and as a society to prevent suicide, and that's what we're here to discuss today. In the United States, suicide rates are recorded by the Centers for Disease Control and Prevention, otherwise known as the CDC. According to the CDC, 48,344 people died by suicide in 2018. This makes suicide the 10th leading cause of death overall in the United States. Per the CDC, the rate of people dying by suicide has increased by more than 30% in the last 2 decades. And I apologize, we have a little bit of a typo in that screen, in that slide, I should say, that we weren't able to fix. But what we understand is that it's increased by over 30% within the last 2 decades. Suicide now takes more lives than does homicide in the United States. And furthermore, it's important to understand that suicide does not discriminate. Dr. Welke mentioned this earlier, that all people can be affected, of all ages, all ethnicities. And that is one of the reasons, in addition to these numbers and statistics, that it's important to talk about suicide like we're doing today. The more that we talk, the less that stigma is attached to the idea that many people face these struggles and need support. It's also important to note that for every death by suicide, 25 others attempt suicide, is at least the current estimate. That is a lot of people. It's about 1 million Americans each year who survive a suicide attempt. And yet it's important to talk about how suicide can be prevented and to talk about what we can do to assist in preventing suicide. Just like there are warning signs and risk factors for other health crises, like cardiac arrest, we can learn by watching the signs and learning the warning signs and the risk factors that can help us to prevent people from dying by suicide. As with other health issues, prevention can start early, far in advance of the problem, or prevention can occur closer to the time of the crisis. To prevent suicide, we need to identify persons who may be suicidal, as well as take an active role in connecting them to help before they take action to end their lives. So before we start talking about risk factors, I want to back up really quickly and ask one of the main questions that research explores, which is, why do people take their own lives? So through research, we have learned that suicide is incredibly complex. In other words, there is no single cause. Suicide most often occurs when stressors and health issues converge to create an experience of hopelessness and despair. So let's talk more about those stressors and conditions that can increase the chance that a person may take their life. We refer to characteristics and conditions that increase the chance that a person may consider or attempt suicide and or take their life as risk factors. So that's what we're going to be talking about right now. And identifying risk factors can help us to understand the bigger picture of someone who is considering suicide and having suicidal thoughts. The main risk factors shown here can be broadly grouped into 3 categories: health factors, historical factors, and environmental factors. These risk factors can converge at different times in life and increase a person's risk for suicidal behavior at a certain point. Let's talk about health-related factors first. So, struggling with mental health conditions can be a major risk factor for suicide. That being said, it's also important to note that the vast majority of people who struggle with mental health conditions do not actually die by suicide. So I think that's also an important caveat to remember. Other health-related factors can be certain medical conditions and chronic pain that can also be risk factors for suicide. In terms of historical factors, previously having a suicide attempt can be a risk factor for attempting suicide in the future. In addition, having a family history of mental illness or substance abuse, or having family members who have died by suicide, can also serve as risk factors for suicide. In terms of environmental factors, these may include having access to firearms in the house, the presence of domestic or interpersonal violence in one's home, being exposed to others' suicidal behavior, such as that of either family members, peers, or celebrities, and experiencing a prolonged, stressful life event. Those can all potentially be risk factors for suicide. Now, again, please note, many individuals have some of these risk factors and do not attempt suicide. However, it is important to watch out for these risk factors. So I also want to talk about the role of the current pandemic that we are all experiencing and how that may intersect with suicide risk. So within the context of already increased rates of suicide, the coronavirus has arrived on the scene. And along with it, potential stressors that may serve to increase the risk for suicide for some individuals. Before I go further, it's important to note that the impact of the impact of COVID-19 on suicide rates is still unknown. However, there are some initial indicators that rates of suicide thoughts, symptoms of depression, and also symptoms of anxiety are increasing. So there are some initial indicators, and yet, again, the ultimate impact is yet unknown. So from the information that we do have, we understand that contracting COVID-19 may put someone at heightened risk of suicide. It's possible that having pre-existing conditions, being immunocompromised, and having a history of substance abuse can put someone at additional risk of having suicidal thoughts and potentially attempting suicide at this time. It's also important to point out that social connection plays a very big role in suicide prevention generally. This presents another layer of challenge during this current pandemic, given that social distancing is a very critical public health strategy in the battle against the spread of the disease. So, unfortunately, while suicide rates are already high and the pandemic comes on the scene and we believe may be increasing risk in some ways, social distancing may also lead to secondary consequences such as increased isolation and loneliness that may further increase suicide risk. We also know that those already experiencing suicidal thoughts may already lack social connections and may continue to isolate or disconnect from others as these thoughts increases. So this is a challenging interplay of factors that we're dealing with during this time that may lead to increased risk for some people. Now, I think it's also important to note that all of that being said, historically, when people have banded together to rebuild and recover in the aftermath of a large-scale disaster, we have seen that the sense of community and purpose can lead to a decrease in suicide rates, and this is very promising. So just like there are risk factors that increase a person's risk for suicide, there are also protective factors that lower someone's risk. First of all, if you are proactive about mental health and make an effort to get healthier to protect yourself, that can be a protective factor. And we're going to talk more about that in a moment. Also, feeling connected to family and community support can protect against suicide. When someone is struggling with depression, anxiety, psychosis, substance abuse, these protective factors that may normally be strong can actually erode or temporarily weaken. And when that happens, having friends and family to remind us of our strengths can be a tremendous protective factor. Having problem-solving skills can also help. Life can get really tough, and being able to see a way through problems can absolutely be a protective factor. Also, cultural and religious beliefs, especially those that encourage connecting and help-seeking, discourage suicidal behavior, or create a strong sense of purpose, can be a protective factor for some individuals. So let's talk a little bit more about how to be proactive about mental health, knowing that this can be a protective factor. So, as I mentioned a few moments ago, taking care of our mental health is just as important as taking care of physical health. And from my perspective and from the perspective of most folks in the mental health field, hopefully others as well, I absolutely believe that seeing a mental health professional is a sign of strength. This will involve a thorough evaluation to figure out if there is a mental health condition affecting either your life or someone else's life. There are many types of treatment available, like various kinds of psychotherapy and also medications. Research has shown that for many people, the combination of psychotherapy and medications tends to be the most helpful. However, the most important thing is finding the right treatment that works best for the individual. So we would leave that in the hands of the mental health professional. That may involve an evaluation to determine what's going on with that person. I also wanted to just mention that when it comes to mental health treatment, there is a continuum of levels of care. People are most often familiar with outpatient care, that's at the bottom left of your screen, which may involve seeing a therapist and a psychiatrist routinely. That could vary from once a week to once every several months. Then there are also higher levels of care. The PHP-IOP level of care stands for Partial Hospitalization Program or Intensive Outpatient Program. And this is actually two of the levels of treatment that we have at Compass Health Center. At this level of care, people may start by attending treatment for a certain number of hours each day or 5 days a week. And then over time, they may begin to reduce the hours and the number of days that they're in treatment. There's also residential treatment that is a step higher than PHP-IOP level of care. And that involves temporarily residing at the location in which someone is receiving intensive treatment for the course of their treatment, where they can really focus on their recovery and also not maybe have to deal with some of the psychosocial stressors that may come along with living in their environment. And above that is inpatient hospitalization. So this may be necessary when someone needs around-the-clock support and care, or if someone is an imminent risk to themselves and others. So, in addition to engaging in mental health treatment, self-care strategies are very important. Proactive self-care strategies like good sleep habits, exercise, nutrition, stress management can also play a critical role in protecting mental health and promoting resilience. For people who are at a crisis point, the most important thing that you can put between a person who is feeling suicidal and their way of ending their life is time. Research shows that by temporarily reducing someone's access to lethal means, we give them time for the intense suicidal risk to diminish, and time for someone to intervene with mental health support and resources. In most cases, when someone who is suicidal does not have current access to the means that has been on their mind, they don't substitute with another method. So therefore, a clear way to prevent suicide is to limit access to lethal means. Now let's talk about warning signs for suicide. These are very important to watch for in yourselves and in others. While many of the suicide risk factors we discussed earlier endure over a longer period of time, warning signs are signs that someone may be at more immediate risk of suicide, especially if the behavior is new or has increased recently. It's important to pay attention to both the risk factors and the warning signs that we're going to talk about now. If you see warning signs, reach out to individuals in your life that you're concerned about and reach out to others if you're struggling. Seek mental health services if you are depressed or if your anxiety regularly interferes with your daily life, and encourage others to do the same. So, suicide warning signs are typically displayed in three main ways that we can detect: talk, behavior, and mood. For talk, this may look like someone expressing a desire to die or to kill themselves. Someone may also talk about not having a reason to live, having excessive feelings of guilt or shame, or being a burden to others. In terms of behaviors that represent warning signs may include someone making a plan or researching ways to kill themselves. This could be someone obtaining the means withdrawing from family or friends, saying goodbye, giving away important items, making a will, perhaps taking dangerous risks out of nowhere, extreme mood swings, a significant change in eating or sleeping, and also could involve increased substance use and even abuse. And finally, in terms of mood, which is another way that we describe how someone is feeling emotionally, if someone expresses feeling empty, hopeless, trapped, extremely sad, more anxious, agitated, full of rage, being in unbearable physical, emotional pain, or feeling like they have no reason to live, these may also be warning signs that indicate someone is struggling with suicide or suicidal thoughts. So that's a lot of things to look for. So to sum it up, look for changes in behavior and trust your instincts. Assume that you are the only one who is going to reach out to that person. In far too many instances, people talk about their concern for someone amongst themselves or with others, but hesitate to reach out to that person directly. So here's a rule of thumb. If you're wondering if someone is depressed or overly anxious, that is a sure sign you should reach out. Same goes for you. If you're having suicidal thoughts, that's a sure sign you need to seek help. So please do. Try talking with someone else, with a professional, and even if suicide turns out not to be a concern, that person may still be in distress and may ultimately feel comforted and appreciate knowing that you care and knowing that you took the time to listen. So how do you reach out to someone? First, talk to them in private. Listen to their story and express empathy, caring, and concern. It's also important to ask directly about suicidal thoughts. Don't be afraid to ask the question, are you thinking of ending your life? Studies actually show that when people ask directly about suicide, this does not increase the risk of suicidal thoughts and actions. Also important to encourage them to seek out mental health services. And of course, if they are in immediate crisis, take them to the help. Now, if you think this person may make an attempt on their life soon, please stay with them. Don't leave them alone. Also, help them secure or remove lethal means or remove them from the potentially dangerous area. Once again, reducing access to highly lethal means and places is very important in suicide prevention. Finally, escort them to mental health services or to an emergency room if you can. All of that being said, if the situation puts your own life at risk, please leave the area immediately and call 911. One option is helping them to call the lifeline, the suicide prevention lifeline, or calling the lifeline yourself, and a trained counselor will tell you what you should do to help the person in distress. If the person that you're with doesn't feel comfortable speaking to a counselor by the phone, they can also text TALK to the crisis text line at 741-741. We will be showing these phone numbers at various points today. I encourage you to write them down, to keep these numbers, maybe even to take out your phone right now and put them in, to enter them as contacts. Even if you never end up using these resources yourself or for yourself, you may need to use them at some point to help a friend. Also important to know that these resources are open 24 hours a day, 7 days a week, 365 days of the year. So very important resources to take away with you today. And remember, if it's an emergency, such as a suicide attempt in progress, or if you are in danger yourself, please do call 911. I hope that you guys found that information to be helpful and that it will be useful in your future. The more that we understand suicide and communicate about this important health issue, the more success we will all have reducing the stigma associated with suicide, as well as helping those who may be struggling and ultimately saving lives. Thank you again for joining this session and being here today. At 11 a.m., the Teal Bead community discussion, also presented by Compass Health Center, will begin. The team will be back soon to kick off that session, and please have a safe, healthy rest of your day. Thank you again.